If you've been following sports at all in the past couple of weeks, you know that one of the big topics of discussion has been head injuries and concussions. And to talk about those, we welcome in Dr. Arif Dalvi, a neurologist and the director of Comprehensive Movement Disorders Center at Palm Beach Neuroscience Institute, which is often shortened to PBNI. Dr. Dalvi is also the physician chief of the Movement Disorders Program at Delray Medical Center. Doctor, welcome to the show, and thank you so much for joining us.
Thank you so much for having me.
Doctor, getting right into it, starting with Miami Dolphins quarterback Tua Tagovailoa, there have been several concussions, serious head injuries in the NFL over the past couple of weeks. First off, what are the signs and symptoms of a concussion?
So the signs immediately can include confusion, a blank expression, delayed response to simple questions, agitation. One very common symptom is headache, also some dizziness, visual changes, and these folks tend to forget the event at times right after it has taken place. One big red flag is vomiting, because that can indicate increased intracranial pressure and the person needs immediate attention. And also, if they're having loss of consciousness or later in the day their level of consciousness is fluctuating, that also is a big red flag.
How does a concussion affect the brain? What actually happens inside of our skulls when an event happens that would lead to or be diagnosed as a concussion?
So our brain is well protected by our skull bone, but what we should remember is that within that cavity, the brain is actually floating in cerebrospinal fluid, CSF for short. So when you have this movement of the brain that happens because of trauma, you have the brain floating in such a way that it can be damaged directly at the point of contact. There's a fancy French word for it. It's called a coup injury. Or it can bounce around, and at the opposite point, it can be damaged. It's called a contre-coup injury. Also, it can rotate within the CSF. And these rotational forces, they can cause tearing or shearing of the axons, which are the long tracks that go out from the neurons to other parts of the brain or the spinal cord. So through multiple mechanisms, the brain can be injured. There are biochemical cascades that are set in place also if the injury is severe enough that can result in medium-term damage to the brain. So a whole range of mechanisms are at play here.
So why should somebody see a neurologist for a concussion?
So if you have a history of head trauma or sports injury that is even anything beyond mild, if you have any persistent change in memory or personality or cognitive function, it's a good time to see a neurologist. One thing I would caution you, again, coming back to those red flags, if you have a severe headache that persists or vomiting or fluctuation in consciousness, don't even bother to set up an appointment with the neurologist. Go to the emergency room, because an emergency CT scan could be life-saving in some cases.
Again, I'm here with Dr. Arif Dalvi, director of the Comprehensive Movement Disorder Center at the PBNI, which is short for the Palm Beach Neuroscience Institute. Doctor, the NFL added the term ataxia to their concussion protocol. I'm not even sure if I'm pronouncing that right, but if I am, what is ataxia?
So ataxia is another term for impaired coordination. It can affect balance, movement of other body parts. When you have a lot of alcohol and you're asked to walk a line, you can be ataxic. You can have an unsteady gait. Ataxia indicates damage to the brainstem, which is the deeper part of the brain, and so it's very vital to check for, and it's good that the NFL has added it to the concussion protocol.
Doctor, you specialize in movement disorders at the PBNI and the Delray Medical Center, and you are also the director of Memory Disorders Center at St. Mary's Medical Center. Some studies and some former NFL players surmise that playing football has increased their risk of CTE, Parkinson's disease, Alzheimer's disease. One example specifically was New York Jets defensive end Mark Gastineau. He told a New York radio station that he's been diagnosed with Alzheimer's, Parkinson's, and dementia. Do you think there's a correlation between playing football and an increased risk in those conditions?
So any contact sport, whether it's football or boxing or even to some extent soccer or ice hockey, can be associated with a higher risk of Parkinson's disease, and Alzheimer's. Even a single traumatic brain injury can increase the risk of Alzheimer's disease, Parkinson's disease, and also motor neuron disease, which is also called ALS. It's difficult to point out a direct cause and effect relationship, but statistically we know that head injury can bring out Alzheimer's disease and Parkinson's disease symptoms sooner. I myself have followed a number of these athletes from my time in Chicago. I was following some former Bears players, and I've seen a whole range of players over here in my present position also as part of the NFL program. But even single injuries can raise the risk. But certainly if players are returned back to the field too early, that repeated injury in particular accelerates those neurochemical cascades in the brain and in the long term can significantly affect cognitive function.
Like you mentioned, you spent some time in Chicago. You are a Bears fan, and your team is in the middle of the pack, led by young quarterback Justin Fields, who recently said that after seeing Tua's head injuries and subsequent concussions, that he's thinking and is more cognizant about ways to protect himself. Do you think that with players having more information about concussions, players learning ways to protect themselves from the type of hits that cause concussions, along the advent of safer helmets and unaffiliated neurotrauma consultants, can that help lower concussions, or can it only do so much when you're playing a contact sport and at the end of the day, a violent sport like professional football?
Listen, we all love our athletes. We all are fans of football, but we want to keep these athletes safe, not just for the short term, but as they grow older in life. And so raising awareness of traumatic brain injury, raising awareness of concussion and the long-term effects is extremely important. I'm glad the NFL is taking measures. For example, the Guardian caps that pad the standard helmets can somewhat reduce the impact forces. That is a good step. If you keep in mind, our cars, they come in with crumple zones so that when you have an accident, that part collapses, but not the interior of the car, so you're protected. Similar principle behind Guardian caps, that you're reducing the impact forces and maybe reducing the injury to the brain in the long run. So I don't think this is a definitive answer, but certainly I'm really glad that the NFL is taking these steps.
Again, I'm here with Dr. Arif Dalvi, a man of many titles, including the physician chief of the Movement Disorders Program at Delray Medical Center. Doctor, it was a very scary moment when the University of Michigan running backs coach Mike Hart suffered a seizure during the first quarter of a recent game against Indiana. Hart, just 36 years old, collapsed near midfield. What causes a seizure, and why should somebody see a neurologist for a seizure?
So a seizure is a sign of an irritable brain, and there is a whole range of causes: infection like meningitis or encephalitis, a trauma including head injury, abnormal brain structure which might be present from childhood can cause epilepsy, which can lead to seizures, electrolyte imbalances, too little sodium, for example, can lead to seizures. Perhaps the most concerning is that a seizure can be the sign of a brain tumor. So anytime you have a seizure, it's a no questions asked reason to see a neurologist, because we can evaluate you with techniques like EEGs, where we look at brainwave activity and try to diagnose seizure activity through that, and also MRI imaging to look for any signs of any structural change. So it's extremely important to be evaluated fairly urgently if you've had a seizure.
You specialize in Parkinson's disease, which some studies point to a higher incidence in men than in women. What are some signs and symptoms of Parkinson's disease and some of the latest treatment options that you're offering today?
So the most common sign of Parkinson's disease is tremor, but we also look for signs of muscle stiffness, slow movements, and difficulty with walking and balance. We at Delray Medical Center are really advancing treatment in Parkinson's disease. We have a number of new technologies. One is deep brain stimulation surgery, and we are using sophisticated pacemakers that allow us to actually sense the brain activity. It's called brain sense technology, and also a different type of electrode that is implanted in the brain called a directional electrode. But perhaps the most exciting work we're doing is with a brand new technology called focused ultrasound, because you have low levels of dopamine in the brain that creates those four symptoms I mentioned. But those low levels of dopamine create excessive electrical activity in certain areas of the brain. It's like an arrhythmia of the brain. And we're able, without an incision, without any device being inserted into the brain, to zap that area of the brain with focused ultrasound, and that can help reduce the symptoms in a significant way. So Dr. Lloyd Zucker, who's Chief of Neurosurgery at Delray Medical Center, and myself, we've been collaborating on research, and we are one of the leading centers in the country with focused ultrasound research for Parkinson's. We're also expanding it to some extent to Alzheimer's studies as well.
Wrapping things up here with neurologist Dr. Arif Dalvi. Doctor, another one of your specialties is in memory disorders, Alzheimer's disease, and dementia. What are some of the signs and symptoms of those conditions, and when should somebody see a neurologist if they are worried about those outcomes?
So everyone, as they get older, hit their 50s and 60s, start to have some mild trouble with memory, like forgetting the name of a person that they had seen a few years ago and so on. But if you start to have frequent issues, so for example, getting lost in familiar routes, or taking longer to complete familiar tasks, or misplacing items in wrong places, mixing up words, or significant word-finding difficulty, or any sort of memory loss affecting your home or work life, I think it's time to be evaluated by neurologists. Number one, we can look for reversible causes of memory loss. Number two, we can adjust your lifestyle in a way that reduces your risk of Alzheimer's disease and other dementias. And number three, there are treatment options possible for these conditions. And again, as I mentioned, we are involved with some very cutting-edge research at Delray Medical Center with focused ultrasound for Alzheimer's disease dementia as well.
Obviously, the best medicine is prevention. Are there any ways that people can limit their chances of developing a memory disorder?
Physical exercise is one of the best ways of reducing the risk of memory disorder and indeed Parkinson's as well. It can be neuroprotective in a sense. A good diet, particularly one that resembles the Mediterranean diet, has been shown in study after study to slow progression in these conditions and possibly be preventive as well. And then just like, if you don't use it, you lose it. It's true for your muscles. It's also true for the brain. So staying cognitively engaged, staying socially engaged is extremely important.
Lastly, you already mentioned some of the treatment options for a memory disorder. What does treatment for memory disorders look like in the next 3, 5, 10 years? Are there any new technologies that are being studied, being worked on that you think are particularly interesting as we try to learn more about these diseases of the brain?
So for treating Alzheimer's in particular, it's an exciting time because we've had just, two classes of drugs that we've been using for the last 2 decades, which only mildly slow progression in Alzheimer's disease. But there's a new class of drugs based on monoclonal antibodies that is being released step by step that shows promise in dementia conditions, especially Alzheimer's disease. And again, we are looking at focused ultrasound as a way of helping patients with Alzheimer's disease. This is a very early stage trial, but the concept is that there's bad protein in the brain called as amyloid protein that causes damage to the neurons, and we're able to open the blood-brain barrier with focused ultrasound to reduce this amyloid burden and potentially reduce the risk of Alzheimer's or to help with symptoms of Alzheimer's. So again, this is a early stage trial, but hopefully a lot of promise for these conditions.
Doctor, thank you so much for your time. Thank you so much for sharing all this valuable information. I greatly appreciate it, and I look forward to speaking with you again soon.
It's been my pleasure. Thank you so much.
For more information on Dr. Arif Dalvi, visit pbni.com. Again, that is pbni.com, or call Dr. Dalvi's office at 561-572-9371. Dr. Dalvi's office at the Palm Beach Neuroscience Institute is located at 8756 Boynton Beach Blvd, Suite 2500, Boynton Beach in Canyon Town Center. And again, Dr. Dalvi is on staff at Delray Medical Center.